Did you know that right now, your body could be sending you warning signs that your blood sugar level is higher than normal, and you might not even realize it? When blood glucose levels are elevated but not high enough to be diagnosed as diabetes, this is known as prediabetes. But early diagnosis and treatment can mean the difference between living a long, healthy life and suffering from health problems like nerve damage, kidney disease, heart disease, strokes, and blindness. In today's video, we are going to talk about the top 12 symptoms of prediabetes. Number 1. Unexplained mood swings. Healthy glucose levels are necessary for mental well-being. When blood sugar levels in the brain are higher than normal, the excess sugar makes a person more anxious, irritable, angry, and unable to concentrate. When stress increases, it becomes harder for insulin to function properly, and blood sugar levels rise. However, when blood sugar levels return to normal, these symptoms usually disappear. Number 2. Higher than normal blood glucose levels. Prediabetes is characterized by higher than normal blood glucose levels. This means that the fasting blood glucose level is in the range of 100 to 125 milligrams per deciliter, and the hemoglobin A1C level is between 5.7 and 6.4%. Prediabetes is also referred to as impaired glucose tolerance, IGT, or impaired fasting glucose, IFG. Number 3. Digestive issues. Researchers have observed a higher frequency of gas, bloating, early satiety, nausea, heartburn, and constipation in people with prediabetes. This may be due to vagus nerve damage, resulting from high blood sugar causing chemical changes to nerves over time. The vagus nerve regulates how quickly your stomach empties, and when it's damaged, food stays in the stomach longer than it should. This condition is called gastroparesis. If digestive issues persist or cannot be explained by eating habits and other conditions, it is best to consult a doctor for a pre-diabetic assessment. Number 4. Slow wound healing. People with prediabetes may experience slow wound healing. Over time, high blood sugar can damage the lining of small blood vessels and cause poor circulation. As a result, minor bruises and cuts can take longer to heal. Number 5. Hunger and weight gain. Persistently high blood sugar makes it harder to lose weight, which can really help with prediabetes. Insulin-resistant cells have difficulty absorbing glucose from the blood, causing sugar levels to rise. Insulin resistance also increases hunger, making you eat more. The extra blood glucose signals the pancreas to produce more insulin, but more insulin encourages the body to store the extra sugar as fat. And so the cycle continues. Research also shows that people with prediabetes who prefer evening activities, go to bed late, and do not get enough sleep, gain more weight. Losing just 5 to 10% of total body weight can significantly reduce blood sugar levels. Number 6. Frequent urination and excessive thirst. When your body has excess glucose, your kidneys cannot reabsorb all the blood sugar and return it to the bloodstream. As a result, sugar leaves the body through urine, making you go to the bathroom more frequently. Consequently, your body craves more water, making you constantly thirsty. It's a vicious cycle. Coffee and tea drinkers may urinate more frequently due to consuming more caffeine. If this stimulus is not present, frequent urination may indicate prediabetes. Number 7. Skin conditions. Some people with insulin resistance and prediabetes may experience acanthosis nigricans, a darkened area of skin on the back of the neck, armpit, groin, or elsewhere that feels like velvet. Skin tags on the eyelids, neck, armpits, and groin are another symptom of high blood sugar. Number 8. Unexplained fatigue. People with prediabetes already have insulin resistance, which means the body cannot efficiently convert blood glucose into energy. The result is unexplained fatigue. People with prediabetes may feel exhausted even without physical exertion. Number 9. Numbness and tingling in hands and feet. Studies show that prediabetes can damage nerve fibers and cause nerve deterioration without the onset of type 2 diabetes. There appears to be a two-way relationship between impaired glucose tolerance, IGT, and neuropathy. A substantial proportion of individuals with idiopathic neuropathy have prediabetes. and a substantial proportion of those with prediabetes have peripheral neuropathy. Number 10. Kidney damage. People with prediabetes often have unrecognized chronic kidney disease, CKD. In one large study, more than one-third of people with prediabetes were found to have signs of kidney disease. Additionally, the stage of kidney disease is 3 or 4, the same as in people with diabetes. Stage 5 is the worst. That's when a person needs either dialysis or a kidney transplant. Number 11. Aching joints. People with prediabetes have excess body weight, which puts extra pressure on the joints, particularly in the lower body, and increases the risk of osteoarthritis, OA. A recent report from the CDC found that 32% of adults with prediabetes also have arthritis. Researchers found that approximately half of adults with both prediabetes and arthritis are either physically inactive or have obesity, further increasing their risk for type 2 diabetes. Number 12. Blurred vision. Prediabetes can increase the risk of vision loss, retinopathy. This is because high blood sugar causes the lens of the eyes to swell, impairing the ability to focus. However, the blurring goes away when blood sugar levels return to the optimal range. This symptom is often linked to prediabetes after a diagnosis.